Assalamualaikum doctors. In this video I'm discussing how can we take the history about nephrotic syndrome. So it recently come on Qatar yesterday. So what is the chief complaints can we come? Like two scenario it comes. Number one is that you will talk to Miss Huda, mother of Ali. He's a 6 years old, came with eye swelling. So one can be come with eye swelling. Another can come like you will talk to Alma. Alma, there is 14 years old girl, known case of nephrotic syndrome and came for follow up. So one is follow up case and one is eye swelling. So how can we do? So first, chief complaint analysis: eye swelling, is it unilateral or bilateral? The onset, course and durations, what make it better and what make it worse? Any diurnal variations, any swelling in other parts of the body, sequence of the swellings, red eye, excessive lacrimations, oozing pus, affects visions, pain when moving eyes, bulging eyes and light intolerance. Urinary about we ask change in any pee, whatever the color of the pee, amount, frequency, pain, either through the urine. Very important. Through the urine means proteinuria. Recent any bug, urinalysis, anyone measure his blood pressure. Generally fever, weight changes, level of activity, sleep, sting bite around the eye or elsewhere. And other concerns like any dysmorphic features, chronic illness or long-term medical conditions, known patient, take it in details. Now about the systemic review we are going to ask. First, GIT, increase the tummy size, tummy pain, loose poo, throwing up, yellow eye, mouth ulcer, stria on the abdomen. Then CVS about number of pillow. If more than one, ask about the pillows before, chest pain, exercise intolerance, awareness of the heartbeats and blood pressures. CNS about signs of increased ICT, then headache, fainting, altered consciousness level, unusual movement, fits, hearing concern, unusual gait and facial asymmetry. Chest about the coughs and colds, recurrent bug, rapid breathing, noisy breathing and oxygen saturations. MS or skin, we can ask like skin spots, lump, joint pain, joint swelling, changes in hair, nails, increase interscapular pad of fat. So increase interscapular pad of fat, very important side effects of steroid we know. Hematology about the pallor, bleeding, bruising and recent bug. Endocrine heat intolerance, blood sugar measured. Past history we know usually we can ask 5T IOA. So when the diagnosis date, where, by whom it was diagnosed, how was it diagnosed, test done, biopsy if frequent, steroid dependent or resistant, steroid given, dose, duration, effect of the treatment, improved or not, recurrence of the symptoms, when, during steroid withdrawal or after, side effects of the steroid, other drugs given, then follow up of the team, follow up the visits, regular on treatment or not, who gives him the treatment, diary, duration, bracelet, emergency plan card. Then about the operation, admission frequency, is that the admission in the ward or ICU, trauma, travel and the transfusions. Then as usual the perinatal history, if age less than 1 year, ask about the birth weight and hypothyroidism, screening. Puberty if relevant, vaccination, missed any shots, extra shots, annual shots, any previous exposure to varicella. Allergy important, nutrition edema, type of food, water and salt content in the diet, follow up with dietitian or not. Then development plus growth charts, family history of similar condition or any chronic kidney disease, consanguinity, social, financial plus home, psychological, school, impact, how does his condition affect the family. So the degree of eye swelling I am telling, it is unilateral and bilateral. Unilateral local cause or anaphylaxis. The DDR, it can be unilateral allergy, sting bite, eye trauma, orbital cellulitis, eye infection secondary to facial palsy and exophthalmos. Among them we know orbital cellulitis come history. So also in video station. Bilateral part of generalized edema or local cause anaphylaxis. The first bilateral cause are nephrotic syndrome. When nephrotic syndrome comes in our mind, is it first diagnosis, relapse, steroid dependent or steroid resistant? We have need to exclude nephritic syndrome or not, because hematuria or not we ask. Orbital cellulitis bilateral rarely can be occur. Anaphylaxis, hereditary angioedema, cardiac failure, renal failure, liver cell failure, malnutrition, that is kwashiorkor, protein losing enteropathy and exophthalmos. So nephrotic syndrome on steroid, it decrease the immunity. Okay, so this is all about how can we take the nephrotic syndrome history. Thank you.